Caitlin Dykes, and today I'll be talking to you about artificial intelligence in surgery and medical imaging. I'm first going to start off by discussing the current problems in the radiology and surgical fields. Then I will go into the theory of artificial intelligence. Next, I will briefly talk about the history of robotic surgery. Then I will go into a few technological applications of artificial intelligence, and then I will conclude my presentation. So, the workload of radiologists has increased substantially in the past few decades. From 1997 to 2006, the number of MRI scans nearly tripled and CT scans doubled. It's estimated that a radiologist has to interpret a medical scan every 3 to 4 seconds to meet the work demands in an 8-hour day. Now, if a radiologist is interpreting scans that quickly and that frequently, it's very possible that they can make an error in their diagnosis, greatly affecting a patient's life. Now moving on to the problems in surgery. Two of the most common problems in surgery are hand tremors and poor visibility. Now, if a surgeon's hands shake during surgery, they could accidentally puncture an organ or make an incision that they didn't mean to, which could lead to complications during the surgery. The second problem is poor visibility. Now, if a surgeon makes small incisions, they might have a problem seeing what is going on in the body. So oftentimes they will make a large incision, almost a foot-long incision, to ensure visibility. However, this can lead to a large blood loss during the surgery, as well as a long and painful recovery for the patient. Now I'm going to go into the theory of artificial intelligence. Artificial intelligence is smart. It learns from experiences, just like humans do. This is called machine learning. It is able to do this through what are called artificial neural networks. Artificial neural networks are essentially a computerized version of the brain. Your artificial neural networks receive data and then process that data through its hidden layers to produce an output. Those hidden layers can contain mathematical operations, structural analysis, pattern analysis, etc., for the technology to learn to classify data. Now I'm going to go into the history of robotic surgery. Robotic surgery is a pretty new field. The first ever robotic surgery was documented in 1985. A robotic arm called the Puma 560 was used to assist a surgeon in a brain biopsy. Fast forward 5 years and the first voice-controlled robot was created. A surgeon didn't even have to use their hands to perform a surgery. Fast forward 10 more years to 2000 and the first ever fully integrated surgical system was FDA approved. This surgical system was called the Da Vinci system. Ever since its 2000 FDA approval, it has gained popularity worldwide. There are over 44,000 Da Vinci systems currently being used worldwide for a multitude of surgeries. Now I'm going to talk about the AutoMap. The AutoMap is an artificial intelligence software created by the Massachusetts General Hospital researchers and Harvard University. AutoMap uses artificial neural networks to take in data and from that data analyze patterns and structures to be able to distinguish between healthy and unhealthy patients. So it can aid radiologists in diagnosing patients. In addition to this, AutoMap is also able to provide instant feedback during a medical scan. Now, if a radiologist is performing an MRI or CT, the AutoMap can tell it that, hey, the frequency needs to be changed so that the image can be clear. That way it ensures that the radiologist is getting as clear of an image as possible to ensure that the correct diagnosis can be made and the patient will not have to come back for a second scan due to an unclear scan. Thirdly, the AutoMap has the ability to create very clear images. So in this image on the left is an MRI of the brain using traditional software methods. Now, as you can see, it is very pixelated. It's hard to see the exact details of this brain. Now, on the right is the exact same brain scanned using AutoMap technology. As you can see, it is very clear, it is less pixelated, and you can make out the details in the brain. Another benefit of AutoMap: these clear images allow radiologists to clearly see what is happening in a patient's body, so they can more accurately diagnose a patient. Now I'm going to go into laparoscopic or minimally invasive surgery and robot-assisted surgery. A study was conducted in Poland to compare the effects of laparoscopic and robot-assisted surgery on patients. So in the study, 89 patients had to undergo a radical cystectomy or bladder removal. And in this study, they found that the patients that underwent laparoscopic surgery were hospitalized 2.6 times longer than patients in the that underwent robot-assisted surgery. In addition to this, the blood transfusion cost was higher for patients that underwent laparoscopic surgery. Now, despite hospitalization and blood transfusion being more costly in laparoscopic surgery, the robot-assisted surgery is actually more expensive, mainly due to the fact that the surgical instruments for the robotic system are very expensive. In the laparoscopic surgery, it was $148. In the robot-assisted surgery, it was $1,329. That is almost a 9 times difference in the cost of surgical instruments. However, it is important to keep in mind that robot-assisted surgeries can greatly reduce hospital stay and the possibility for a large blood loss during surgery. Now, just to briefly summarize everything I talked about the increasing workload of radiologists and how they have to interpret a scan every 3 to 4 seconds to meet work demands. I talked about hand tremors and poor visibility being a problem for surgeons. Then I talked about the theory of AI. AI uses machine learning and artificial neural networks to learn from experience. I then went into the history of robotic surgery from the very first robotic arm to the FDA approval of the Da Vinci system. I then went into AutoMap, the imaging software that allows radiologists to improve their diagnosis. Finally, I discussed robotic surgery and compared it to laparoscopic surgery. So, to conclude my presentation, AutoMap can greatly increase the efficiency and aid radiologists in diagnosing their patients due to its artificial neural networks and its ability to produce very clear images. And robot-assisted surgery is costly, but it is more precise than laparoscopic surgery, and it can greatly reduce blood loss and patient recovery time. So patients can get back to their normal schedule in a quicker amount of time. These are my works cited, and thank you for listening to my presentation. I hope you enjoyed it.